with Dr. Sadeghi at his beautiful facility in Old Metairie. And tell us what kind of practice you have, Dr. Sadeghi.
I am a plastic surgeon. I specialize in microsurgical breast reconstruction and cosmetic surgery. I've been in this facility for the past year.
Okay, so when you were in med school, you had lots of different options. Why did you choose to become a plastic surgeon?
I knew I wanted to do surgery from the get-go. I wanted to be in a specialty where I was treating patients and seeing immediate results. And when I looked into the field of plastic surgery, it encompassed so much from head to toe, from adults to children, and you were able to change people's lives, be it in the cosmetic side or on the reconstructive side. And when I got into the reconstructive side and got introduced to the aspect of microsurgery, which is, as many of you out there know already, is working with very, very small structures under a microscope, it blew me away. And I knew at that moment that that's what I wanted to do. And currently, 50% of my practice is dealing with breast cancer and breast cancer microsurgical reconstruction. So it all kind of came together. I can't tell you that I wanted to go into plastic surgery from the beginning. I thought I was going to be a heart surgeon at some point in there. But I'm glad that I chose this field, and I've been able to be blessed to be able to help my patients.
You do have a lot of breast cancer patients, as you mentioned. Is there anything that you've seen as a doctor, if you were to put yourself on the patient side, that you wish things would be a little easier, better, like in terms of insurance or maybe getting care wherever they want or anything like that? Is there anything that you wish was different for patients just to make this whole process a little smoother?
I think over the years the process has gotten better. We're looking back, this is breast cancer is from the beginning. It's a diagnosis that's made, and the patient needs to get into a multidisciplinary group for treatment, be it the breast surgeon, the plastic surgeons, the oncologists, the chemotherapy, radiation doctors, etc. And we're seeing more of that happening, and all-encompassing treatment of the patient, which is really good to see. And it provides that level of comfort for patients, knowing that everybody's taking care of them. And also from the other perspective is the social support side of it, such as Sisterhood and other organizations like Unite that are out there that are helping these patients.
Right.
Because the diagnosis obviously is very traumatizing, and it's hard to see the end of the road when you first get diagnosed. Mm-hmm. But it's when my patients come in, I always tell them it's one step at a time,
right,
one day at a time, and we're going to get you there.
So what would you say is the most, you've touched on this a little bit, the most rewarding thing about your career, especially from the breast cancer side of things?
I think it's, in the field of plastic surgery, at times people that are not within the field think of it as doctors that are just providing cosmetic surgical procedures and enhancing what's already there. But from a breast cancer reconstructive side, this is a whole new outlook that a lot of people don't know about. And patients that are getting diagnosed with breast cancer, they're getting either lumpectomies or mastectomies. This is a very life-altering step in their life, and it's hard to imagine what it feels like to go through that. And we've seen so many patients come to the office where they're devastated by their diagnosis, and they feel like they're going to have their breasts removed, and there's nothing else being offered. But by the time they finish their treatment plan and their reconstruction, they're out the door. They feel 100 times better than when they first walked in. So I think that's the best part of being in my practice is to be able to see that for my patients. Like they come in with that diagnosis that they feel like life's over, and by the time they're finished and the treatment's done, they leave your practice as a whole new person.
Right. So you've obviously been involved with Unite as a sponsor for many years, just over 5 years. What is your favorite thing about Unite?
I think with Unite, it's the energy level. I mean, when you walk into that event, you're just blown away by the enthusiasm, the energy.
When I walked into your office, I noticed how beautiful everything was. It's so light and airy, and I feel like I'm in plastic surgery heaven. Everything is just so serene and beautiful and calming, and I love whoever did your decorating, and your architecture is a genius. It's beautiful in here.
Right.
How long have you been in the building?
We've been here for just over a year. We actually just celebrated a few days back our first surgery here, which was, I think, about 2 weeks ago. And it's been an interesting process coming into this facility. I had planned this for a few years actually, and the design and the architecture was part of my vision of what I wanted a facility to look like, to be, to have open spaces where you could come in and feel comfortable and not feel so claustrophobic as some places I've seen in the past are.
Right.
But you just want to come in and feel comfortable that you're somewhere that you're going to have great results and feel great and recover. We have a surgery center here, soon to be licensed and fully accredited by LDH. So it's all very exciting. It's been not very easy to build, but given everything with COVID and the problems with that, but we've finally gotten here. We're very happy. The patients love it, and it's really nice to see them come in here and just have a great time and just look at their faces, their expressions, and just they feel very happy being here. It doesn't feel like a doctor's office, which is what I wanted to do from the get-go. Right,
and a lot of people, especially when they're going through cancer and they're going through some sort of reconstruction with a plastic surgeon, you feel very anxious. And of course I'm not coming in for surgery today, but the minute I stepped in here, I felt at ease. It just definitely makes you feel at ease, and it doesn't make you feel necessarily like you're at a doctor's office, or it doesn't scream hospital. It's just very pretty and soothing. So.
Right, we used a very soft color palette for the surgery center and the clinic side and the spa, and it's designed to make you feel the fact that you're not in a doctor's office, that things are going to be okay when you walk in here, your treatment, and when you finish and you recover and you're leaving the facility, that you've actually accomplished something. And we talk about this all the time. We're in the business of providing confidence, for many of our cosmetic patients, and for the reconstructive cancer patients, we're restoring them back to what they were like maybe a few years back, or just before their surgery. But it's a very big task, and I just wanted to reflect that in the building as well. When they come in here, I just wanted to feel like they're going to be taken care of.
If you could summarize Unite in one word, what would it be?
That's very difficult.
You can have 2 words.
2 words, okay. I'd say hope and restoration. I think those two really summarize Unite for me.
And you've been to Unite events. What do you feel when you go to these events? What's it like?
Full of energy, full of life. I think that's my word.
That's great. And
life.
You've been a sponsor for you've been a sponsor for just over 5 years now, and you attend a lot of the events, and we're always happy to see you. And many times you see some of your patients on the runway. What's that like for you?
It's amazing. I mean, just amazing when you see patients that you've seen in your office, at their worst time, and you see them on the stage dressed up. They make our job look easy, and they've been through this process, and they've gone through the hard journey of recovering and the treatment of breast cancer and every step that goes along with it, and they're on stage looking like $1 million, and that's what makes me very happy for them.
So a little bit about your personal life. Where did you grow up?
Oh my God, that's a long
story.
long story, but I've been all over the world. I did most of my schooling in Canada, and my residency was in New York City. Then I moved to New Orleans, and I've been here ever since 2009. I went into practice, and it's been, it'll be about 13 years at the end of August this year that I've been in practice. So it's been a great journey. I love the city of New Orleans. Didn't know if I was going to settle down here, but I'm glad I did, because the character and the people of New Orleans are just very different, and there's nothing like it in the country. So I'm happy to be here.
I'm not from New Orleans either, but
Where are you
this is
from?
what I'm from Missouri. But I actually tell people New Orleans, and I didn't think I was going to settle here either. By the way, I thought I'd be here for maybe a year, but I met my husband. I tell people that New Orleans is like mold; it grows on you, and it's hard to get rid of.
That's true.
I'm grateful for the memories. We're aiming for the next big thing. I'll see you soon on the other side.